On today's podcast,
I use diagnoses in a different way than conventional medicine. I'm not going to say, okay, you have PCOS, bye. That's what you have. Like, go find a support group with that. It's more of, okay, this is probably what we're looking at. And knowing that, then we know some of the things that can help.
Right.
And so you're right. Like, looking at just our adrenal health in general, or looking at these different factors.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Hey there, and welcome back to the Vibrant Wellness Podcast, where we continue to ride the tide of inspiration and knowledge when it comes to getting to the root cause of symptoms. I'm your co-host, Jen Rivas, and with me is our amazing Dr. Emmy Brown. Hi, Dr. Emmy.
Hi, Jen. How's it going?
So good, so good. I'm really excited about today's topic. So we've got a true champion of women's health joining us. Get ready to meet the remarkable Dr. Miranda Naylor, Doctor of Osteopathic Medicine and Institute for Functional Medicine Certified Practitioner. Dr. Naylor's journey is a powerful testament to the incredible impact of functional medicine, especially when it comes to women's productive health and hormones. She's experienced firsthand how the conventional medical model was failing women. It was through her own determined pursuit of answers that she unraveled the factors impacting her fertility and, against all odds, naturally conceived two healthy boys, much to the surprise of her fertility specialist. Talk about defying expectations and blazing a trail of hope. So this personal triumph ignited her passion to bring functional medicine to women who are seeking optimal health. As an educator and empowering guide, she equips her patients with the knowledge and confidence they need to embark on their own health journeys. So help me welcome the amazing Dr. Naylor. Welcome to the podcast.
Thanks so much for having me, Jen. And what a lovely intro.
You're so welcome.
We're so glad to have you here, Dr. Naylor. And I'm going to kick it off today. I'd love to hear a little bit about your own health and fertility journey and what led you to functional medicine.
Yeah. Well, my journey here started while I was in residency for family medicine. I was already a doctor, fresh out in the field, getting training in family medicine. And I decided that this was a great time to start my own family, which now in retrospect is pretty hilarious because it's a really, as a doctor, it's a really hard time. And so it was kind of funny that the most stressful time of my life, I decided that was a good time. But it was really eye-opening for me because I didn't get a period when I went off birth control. And I realized how few tools I had, even as a doctor. I sort of just watch and wait. I was like, but there could be more that I am not seeing here. And it really just pushed me into the field of functional medicine. And at the same time, it was sort of that personal experience for myself as I was also treating my own patients and seeing for especially for women's health concerns. Again, there are so few tools. Really, we had birth control pills, maybe some like hormone replacement, and that's about it. And I really wanted to be able to support my patients better and really be able to answer their questions about things like PCOS and hormone imbalance and all these things that they were worried about. And I, again, even as a doctor, really didn't know what to provide them. So that's really what inspired me to go into this field. And I'm so grateful now for my own fertility journey and my own experience here, because again, it led me to where I am now and really fueled the fire for me to create a better landscape for other women to be able to better support their health.
Yeah. And I'm curious, Dr. Naylor, how many cycles or how many months did you wait after stopping birth control before you thought, ooh, I should definitely be getting my period now?
Yeah, it was a few months in where at first I was like, oh, am I already pregnant? I was very naive at first. I was like, oh, I haven't gotten my period. Maybe I'm already pregnant. I was like, no, that not so much. And it's that window of, 3 to 6 months where it's very normal to not get a period back. And so I gave it some time, but then I started to wonder. I had sort of an intuition for myself of, I really think something should be coming back online here. And I think also just not knowing what I could do. Like I felt sort of helpless in not being able to best support myself. And so that was another factor where I was like, well, there has to be something I can be doing rather than just waiting a year until I'm considered infertile. So, yeah.
Right. Yeah. So naturally that led you to focusing on women's health and then seeking out functional medicine, right?
Yeah, that's when I started the training with the Institute for Functional Medicine, and started diving into all of the podcasts and all the things that I could get my hands on,
Yeah.
and really just expanding my knowledge.
Very cool. And so I'm curious, did you find a practitioner during this time? I imagine, I mean, hopefully you found someone to help you along, or was it all self-taught? And what really made a difference in terms of interventions and
Yeah, such a great
workup?
question. Yeah, honestly, I did reach out to different people, and that was a challenge for me as well. Finding the right practitioner, which honestly I don't. There's so many amazing practitioners out there, and I didn't really find the one that I was looking for. And again, in retrospect, I think it was that I was expecting there to be this one person out there who can solve all of my problems. But in reality, it's so internally driven in my experience. And it's like we meet these different guides to help us in different ways. And especially since I was taking this as a professional journey as well, maybe a little bit of stubbornness was getting in my way of like, okay, I can figure this out. I need to get the answers for myself too. So that might have been part of it also. But I did meet, have incredible people like acupuncturists in my life. And yeah. A lot of help.
And it led you to IFM training, which has helped so many practitioners learn this medicine and obviously countless patients. So, and I love your website. You mention modern women's wellness and you help women obtain modern women's wellness. So what does that look like for you?
Yeah. To me, it is, I'm sort of a broken record on this. It's resilience, gaining resilience in this modern lifestyle. And we're living in this world nowadays where we have all of these answers at our fingertips. We can search the internet and find all of these things. And so many women come to me saying, okay, I know all of these things, but I don't know what's right for me. They need that guidance to know what is really appropriate for them. And so it's again, in this modern day world, finding this resilience and this balance to achieve optimal wellness.
I love that.
So true.
Yeah. And on the topic of your website, you have such rich resources for people. One of the ones I wanted to touch on is your preconception detox checklist, in which you share, insights for women to decrease their toxic load prior to conceiving, which I honestly feel like would be a great checklist for anyone. But can you hit some highlights of that and just how that even came about? Was that your own part of your personal story or just research that you did afterwards?
Absolutely. Yeah. And I completely agree. All of us can benefit from this. But especially in the preconception time, it's so important to limit all the toxins we can. Some of the big highlights for that, it's sort of a two-step process. Step number one is limiting the toxins that we can avoid. There's so many things outside of our control, so many toxic things in our environment nowadays, but the things that are in our control, really just trying to take things off of our plate, so to speak, that may interfere with fertility, with conceiving a healthy baby, growing a healthy baby, and that future child's health as well. So even things as simple as taking your shoes off, coming indoors, opening windows, getting some clean drinking water. A lot of our tap water is pretty yucky these days. So simple things like that can make a really big impact in limiting some of these things. As well as being mindful about what we're putting on our skin, on our hair, on our face, because a lot of those things unfortunately contain a lot of bad chemicals.
Yeah.
And the second step in all of this is really supporting our own body's ability to get rid of waste products, to detox, if you will. But really, it's just a natural process that's always happening to get rid of all the waste products. So really making sure that that's in line as well.
Great. It's a great tool. Okay, so we want to really get into the topic of women's health and fertility. And we're going to touch on the guys too a little bit later. But to get started, when I was in practice, and I love women's health, particularly working with premenopausal women, we see a lot of female patients who would complain of dysmenorrhea, acne, ovarian cysts, irregular periods, oftentimes on hormonal birth control, right, to regulate their period or their cycles. I'm doing air quotes for people who are listening with audio only. So it still drives me crazy that that's what women are still led to believe that the birth control pill is doing, or any hormonal birth control pill is method is doing. And so then we think about a lot of commonly associated conditions: PCOS, hypothyroidism, hypothalamic amenorrhea. But it seems like these issues are becoming so much more prevalent. I mean, and this is a huge question. I'm sure there's a huge answer, but why do you really, and we talked about toxins already a little bit, but why do you think this is, Dr. Naylor?
Yeah, you're right. I mean, that's a big question. And we probably don't know every single answer to that. But yeah, I think there are so many things that can be a big insult on our reproductive health nowadays. Toxins are definitely one of them. Like I said, they're ever present. So that can be a really big factor for a lot of us. Another thing is just the busy lifestyles that a lot of us have. We talk about stress a lot nowadays in our daily conversation. We'll say I'm stressed and things like that. But I think most of us don't really understand the impact that stress is having on us, because it isn't always just this big traumatic event. It's this constant busyness, this constant like doing and going and, trying to always be better, all these things that just don't allow our nervous system to come back down to a more settled baseline. I feel like that is a really big factor as well, especially for women. We don't have to get into a gender conversation, but most women take on a lot or maybe internalize more. So for a lot of my female patients, it is a factor that they're not always aware of. We might have a few conversations about it before they come back to me and say, oh yeah, that I'm really seeing the effects of this now. And it's making a big difference to, regulate my nervous system in a different way. I think that's another really big one.
Yeah, I
why
agree.
It's so common nowadays.
And we talk about that a lot on this podcast, and almost even in some cases, people being addicted to that roller coaster of stress hormone. And how do you break somebody out of that cycle is a big conversation. And I think it's a fascinating one. But yeah, so many different factors. And I love how you also say in your site, in regard to testing, you say you'll never be told everything is normal, because there's so many commonly overlooked issues. And just to name a few: thyroid dysfunction, hidden infections, nutrient insufficiency, oxidative stress, cellular DNA damage, etc. So what are some subtle clues as to what might be going on with someone who is coming in and they want to address possible fertility issues? Maybe they do have regular periods, but maybe there's something else that you're looking for in terms of signs and symptoms that might impact a healthy pregnancy.
Yeah. So for women, of course, our menstrual cycle is very central to that. Ovulatory disorders are the biggest factor with some fertility in women, the biggest cause of that. So in my practice, we're talking a lot about signs of ovulation, regular ovulation. When is that happening? What's the time between ovulation and your period to really make sure you're having an appropriate luteal phase? All of those things. If someone is having even bad PMS or spotting before or after their period, really heavy periods, all of those cycle-related concerns, I take as a big clue, because it can be an indicator that things like their progesterone production isn't optimal, or the health of their eggs and follicles aren't optimal, which has a big impact on how ovulation happens, the health of that future embryo, if it is fertilized. So we're usually starting there with a lot of conversation. Other factors could be things like, maybe looking towards thyroid health. So if someone's running really cold, if they're gaining weight inappropriately, if their skin is really dry, their hair is really dry, or on the flip side, if they're feeling really anxious and jittery all the time, they're having palpitations, then those can be big indicators of something not working right. If someone has a lot of inflammation or signs of inflammation, again, it could be like inappropriate weight gain, could be joint pains, overall, body pains or pains that move around. That would be another big factor. I also look a lot at digestive health. our digestive health in so many ways can
Absolutely.
impact our reproductive health and fertility, our hormone production. So, even constipation, or if they're having a lot of bloating and gas, those could be some big signs too, as a cause for subfertility or fertility concerns.
And I love how you just said subfertility, right, Dr. Naylor? And then you said optimal, right? So even if somebody is regularly menstruating, well, can we optimize? Is there room for improvement?
Exactly.
And I think that's really where functional medicine shines. So that's such a great point to make there.
Yeah. I try to limit the word infertility because in reality, so few people are actually infertile. For most, it's just that fertility isn't quite optimized. Things aren't quite in the right balance to, it's always an odds ratio. It's always, a possibility. There isn't a 100% guarantee of getting pregnant ever.
Yeah.
So it's really looking at like what could be limiting that, what could be, decreasing your possibilities.
And it makes it less alarming, right? That word infertility. I totally agree. I always think when I'm writing something like this up for the outline for our podcast, we're going to talk about infertility or fertility or issues with fertility. Because just the psychology of how we talk about these things, that impacts people a lot too.
Absolutely.
I'm just curious with the patients in your practice, Dr. Naylor, is there sort of a pattern that you see with women that are coming to you of a specific condition or certain factors that we talked about, or are you seeing it just across the board?
So there are definitely some more common types of things I'll see. So for example, like PCOS is really common. So we'll see that in different forms too. Not everyone with PCOS looks exactly the same. So there can be different flavors, if you will, of PCOS. Amenorrhea is another one that I see a lot of. Diminished ovarian reserve, which is definitely a less common issue in general, in the general population. But for women who are coming for fertility support, it's another one of the factors where basically the ovarian reserve, the number of eggs left, so to speak, is diminished. So that could be another really common one.
Okay. And we always love to share case studies here. So I'm just curious, do you have a specific fertility case study that kind of stands out?
Sure. Yeah. Well, I have one that's top of mind because she actually just had her baby recently and I just got to see the baby virtually, which was awesome. And I think she's a pretty classic case too, sort of similar to my story. She was very healthy, very health conscious, was trying to do everything for her health. And when she came to me, she was in a place of like, I think I'm doing everything. Like, what more could I do? And she did have some digestive concerns. So, we we did testing. We saw kind of the factors that were going on. Overall, things looked pretty good, but some of her hormone levels were low. She was also having somewhat irregular periods, which I can't remember who had seen her before, but basically gave her the label of PCOS. When I saw her, I was like, you don't have PCOS. You have hypothalamic amenorrhea, and it's just showing up. It's a spectrum. So she was in this phase of like, it wasn't 100% where she would just not get her period ever, but she'd get it, every few months, every 3 months, every 6 months or so. She was really stressed out with work. She was like exercising all the time, eating super healthy. And like I mentioned, digestive concerns, like a lot of bloating and things like that. So yeah, we did her testing. We first started with treating her gut, got rid of her digestive concerns completely. She was having great bowel movements, no more bloating. And then she had to do a lot of work herself as far as limiting her exercise, talking to herself differently, nourishing her body in different ways, really, eating more, getting more fat and things like that. And we were doing some targeted supplementation with her. And she started having normal cycles pretty quickly after her cycle was regulated. It might have been like 1 or 2 cycles. She got pregnant, had a great pregnancy, healthy pregnancy, and I monitored her through that. And then, she just had her healthy, beautiful daughter.
Wonderful.
So yeah, it was really awesome. Really a great example of just someone who is healthy, healthy on paper, really doing things right, and just wasn't doing the right things for her own body.
Yeah. And that's, a nice little segue into my next question, which is maybe routine labs, right? If this patient was coming from another practitioner and they're doing really routine labs, everything probably looked fairly normal, right? At least they're within normal limits. Can you give us a rundown, Dr. Naylor, of some of the less commonly ordered hormone-based tests that you run, including thyroid for somebody struggling to conceive, or even, maybe they are looking to conceive and you just want to do kind of thorough screening workup?
Yeah. So like you mentioned, thyroid, that's a big one to get a deeper look at. Usually, like the conventional testing is usually just a TSH, maybe a free T4 if TSH is abnormal, and TSH being thyroid stimulating hormone for those who don't know. In addition to testing that, I like to test free and total T4, free and total T3, reverse T3, and the thyroid antibodies like TPO, antithyroid globulin, and TSI, depending on the situation. So those are really, really important for me. As far as hormones go, timing is really an important factor that I see not always done in the conventional setting. So for example, doing LH, estradiol day 3 of the cycle. So you're getting kind of a baseline. And if you're testing progesterone, doing that in the mid-luteal phase, meaning usually do it 7 to 10 days after ovulation. Some will say day 21, which in reality is very dependent, depends on when you're actually ovulating. So not everyone is ovulating on day 14 and day 21 might not be appropriate. So that's why I avoid saying day 21 labs. And that progesterone is really helpful to see because that's when we're producing progesterone. So that's why it's important to just check that during the luteal phase. Anti-Mullerian hormone is another one that I'm often checking when we're talking about fertility or preconception. It's a hard one because there's really no good test to see someone's egg reserve, see how many eggs are left or the quality of our eggs. But we use AMH as basically a guess to see, how many eggs you have left, how much time you have to get pregnant. It's absolutely not black and white. So when we look at it, even if it looks a little bit low, a little bit high, we're taking that into context with everything else. That one's also dependent on timing and other things like vitamin D levels. So there's a lot dependent on that. Other hormones like DHEAS is another one that I test, and cortisol to get an idea of adrenal function, some of the precursor hormones prior to testosterone and the other androgens. And as I mentioned, like things like vitamin D, I'm also looking often at nutrient levels that we can test in the blood to get good insight on that, because this can be really important with fertility and just reproductive health as well. So like iron, ferritin, vitamin D are some of the key ones that I'm checking, as well as urine iodine in a lot of cases. Yeah.
What about prolactin? And if so, I see prolactin high oftentimes, and we're just kind of scratching our heads, and they don't have vision changes, right? They don't have headaches. And if you are measuring prolactin, what is the ideal scenario to prep for that prolactin draw? Is it, a few hours after waking up? And then there's a couple other things that I think it's helpful for practitioners to realize about that.
Yeah. I absolutely do test prolactin as well. And pregnenolone. And I think, I don't know if we mentioned all of them. So yeah, some of the like peripheral hormones, if you will, they're like precursors and things like that. Prolactin is really important. And you're right, it can be high or slightly high in a lot of people. And that can be a factor. We're usually doing early morning fasting labs to consolidate with all of the testing that we're doing. So that's usually when we're checking it. I honestly don't have any, we're not too strict on all of the prep. Again, we're like fasting. We're trying to do all these things in once and consolidate
just get them
where
done.
we can between day 3 and 7 days after ovulation. And usually for most, it is consistent and is a great way to at least check in with that. If it's abnormal, then we might do a little deeper dive into things. Yeah.
Yeah. I see, just I think for some women, if they're exercising before they come for the blood draw, that could be a factor with prolactin or sexual activity. But yeah, just do you see it? I see it high in some cases you just wouldn't expect. They're not having galactorrhea. It's like, what do you think's behind that?
Yeah, I think there are a lot of different factors at play. Like some of the toxins and endocrine disruptors might be part of it. Like our adrenal health can be a big factor as well. Again, just having that heightened stress levels can be a factor as well. And you're right. I mean, even sometimes we'll see the liver enzymes be elevated if someone had a hard workout before. Usually it's not as much of an issue if it's like first morning, like they didn't just come from a workout. Sometimes even the day before or like intercourse the night before, it can be a factor. Okay, and so again, if it's abnormal, then usually we're retesting and taking away some of those factors.
Right. Good clarification there. What about functional medicine type labs? You mentioned stool testing a little bit, but I'm really curious about toxins. And I know that can be a huge cause of stress for couples trying to conceive. And when do you do it? Do you do it in a couple that's maybe really stressed out? And I think it can cause a lot of anxiety. So what's your thought on looking at toxins in these folks?
Yeah. Yes, toxin testing can be really helpful. But you're right. It's a big can of worms and can be really stress inducing. I find it helpful. I tend to limit it initially, unless there's a big red flag that we're worried about. Like they have a very clear exposure or they knew that they were high in something. We absolutely need to test to see where they stand now. Otherwise, I try to do sort of like the comprehensive testing to see what their whole health looks like. I do a lot of more functional testing, like organic acid testing.
Okay.
To see, how is their body producing energy? How are they able to, like get rid of toxins? Does it look like they're overloaded in toxins in general? Then if we're seeing something there or like their oxidative stress markers are really high, then I dive a little bit deeper into, okay, maybe it isn't just the surface, like, get rid of these toxins that are clearly, in your life currently. We might have to do a deeper dive into further testing, further detoxification. So that's usually where I start with that. And stool testing is another one that I do commonly because our digestive health is so important and our microbiome can be so important with fertility, even just with like the health of that future child. So usually that's where I start. I try to, limit things because there's so many amazing tests out there, but they're not always necessary and they can get expensive, they can get overwhelming. And so usually I start there. And then again, next would usually be going into the toxins, heavy metal testing, mycotoxin testing for those who have mold exposure.
Makes sense.
Makes total sense. Yeah, because we know that a lot of the data that you can get from these lab tests can be a bit overwhelming, I'm sure, for patients to kind of sit and look at. So it's easing them into that. But well, we have to give our male counterparts a little bit of time on this podcast. So I'm curious, what are the most common contributing factors to male infertility that you see, and how do you manage those cases?
Yeah. So for men, in a way, treating their fertility can be a lot easier because we have direct insight into what's going on with their sperm and can really know, what the factors are there. I would say most commonly what I see, it's very typical stuff. Again, we talked about the toxins. Those can have a big impact. Things like alcohol, marijuana use, having a laptop on their lap, having a cell phone in their front pocket. Sperm are very sensitive to heat. And so even just, wearing really restrictive underwear for a workout or bike riding, those can be really big factors. And so limiting those can make a big difference and improve things a lot. And nutritional deficiencies can be a factor here as well. So zinc in particular is one that we're always talking about, as well as omega-3s for sperm health. And so usually it's pretty, again, typical, nothing like, it doesn't have to be any rare conditions or things like that. It's the typical things that we're all exposed to that we're maybe not being mindful about. And so, dialing those in luckily can be pretty easy. Rarely there are more like structural issues or issues from toxins, in their past or like in childhood or something like that. But those are more rare.
Well, staying on the topic of toxins, I'm curious for couples that seek, preconception care and you've kind of established there's a high toxic load, how long on average does it take for them to reach that optimal state for a healthy pregnancy?
That's a great question. And it's hard to answer because we don't know. Like, there's no perfect level of like, we're very rarely achieving zero, to be completely honest. Like 0, oh, you look great. Like none of your toxins are high. It's really hard to achieve that. And most couples, if they're already trying to conceive, they don't want to wait years for perfect health or, if it might not be necessary. So I would say on average, we're talking about at least 3 months, because we know that's the time it takes for egg and sperm health to have the effects that we're doing now. So we're talking about at least 3 months at minimum, on average, maybe about 6 months to, support their body, get rid of things, recheck things, and make sure that they're at a level that's at least lower where we feel confident that it's not going to have a negative impact on getting pregnant, staying pregnant, or the health of their future child.
I mean, in the big picture of things, 3 to 6 months, I'm sure most are happy to wait that time.
Yeah, it's a blip in time when you look back.
Okay, so we touched on PCOS just a tiny bit, Dr. Naylor, and it's a huge topic, and I would love to go there in more depth. So what's your approach to assessing for PCOS? Because as you also mentioned, it could be misdiagnosed. I think it's overdiagnosed. The syndrome, there's the Rotterdam criteria, but there's other ways of diagnosing it. So what's your approach there?
Yeah. So I try to take a comprehensive approach like I take with everything else. So, first and foremost, talking with the person, looking at what their signs are, if they're having irregular periods, if they're having hirsutism, hair growth, hair loss on their head, acne, things like that, that would be sort of telltale signs.
Yeah.
And then looking at their testing, particularly LH and FSH, I find super helpful to be able to see, on day 3, is there some imbalance there? Typically, if LH is 2 to 3 times higher than FSH, that's an indicator that there is a level of PCOS. I look at insulin levels. I hadn't mentioned this yet. Looking at like fasting insulin, hemoglobin A1C, their fasting blood sugars. That's a big factor for a lot of people with PCOS. So looking at that, as well as their like cortisol, their adrenal health. Sometimes doing ultrasounds. I don't do ultrasounds myself, but sometimes we'll send them out if we think that would give us more information. Polycystic ovaries are definitely not, they're the least hopeful sign to me, because there are other things like amenorrhea in general that can cause polycystic ovaries. So sometimes that's on there, but usually using the rest of them, we can get a good idea. Sometimes we'll do deeper adrenal testing if we need to, like diurnal cortisol, to kind of round out that picture. And usually that's enough to tell us, okay, you're here on the spectrum of it. Because again, I see it as a spectrum where it can show up in different ways. Our lifestyle factors can be kind of counteracting some of the other factors that we have. And so I don't hang my hat too heavily on diagnoses in general. But if it seems suggestive of that, then we'll work in that direction, and can see those factors improve a lot.
Yeah. And I'm sure that workup helps elucidate the flavor of PCOS. As you said, I love how you say that, because I think about variants, but flavors of PCOS is so much more fun. So can you speak to what that means? I mean, my understanding is it could be more adrenally driven. It could be more ovarian driven, obviously, even post-pill PCOS type situations.
Yeah, absolutely. So there are these common factors that we know for, in PCOS in general, they can be issues, but yeah, each woman can have a different emphasis or a different like major concern. So adrenal, like you said, insulin resistance, or like metabolic health, even so, like, well, I should say like androgens as well. I see that one as more of a side effect of the other things. Personally, hormones, while we like to focus on them a lot, they're really a reflection of other things that are going on. And so, ovulation, the higher androgens are generally an indicator of the insulin resistance, even on the ovarian level, or the androgen imbalance, the stress imbalance going on.
And I have to ask Dr. Naylor because, again, I think that a lot of women are given this PCOS diagnosis and they kind of stop there. They stop digging. But non-classic adrenal hyperplasia, I think, is more common than a lot of practitioners realize. Are you ever thinking about that? I know 17-hydroxyprogesterone is a nice screening lab for that. That's something that I personally experienced in my family history. Do you see that at all in your practice?
Yeah, absolutely. And you're so right. That's why taking a more comprehensive look at things, we can just we don't have to just be looking at one sort of like pigeonholed area. We can see, oh yeah. And that's why I use diagnoses in a different way than conventional medicine. I'm not going to say, okay, you have PCOS, bye. That's what you have. Like, go find a support group with that. It's more of, okay, this is probably what we're looking at. And knowing that, then we know some of the things that can help.
Right.
And so you're right. Like, looking at just our adrenal health in general, or looking at these different factors, then we know, or, we can address that thing in particular and monitor things appropriately. And yeah.
It's so empowering too, because we're not just putting a label on it. Sometimes we need those labels, right? For history and for tracking and monitoring and et cetera. But it's really what's at the root of this. What can we do about it rather than just tacking on a label? You have this XYZ.
Absolutely.
I love that.
Especially for these things that we can reverse and undo.
Yeah.
Like you can say that you have PCOS forever, but it won't necessarily look like you have it as long as you're managing things, taking good care of yourself. So yeah, definitely empowering.
So let's talk about the women that you work with that maybe are past the fertility stage and are in that perimenopause, menopausal phase, which I'm sure, I'm not looking forward to it, but I hear it can be very challenging. What are some key strategies or lifestyle modifications that help women sort of navigate this phase and promote that hormonal balance that we all want?
Yeah. So this is another group of women that I love working with. Perimenopause, like you said, it's a wild time, and it can be different for each person, but in general, it can be pretty crazy. In general, the hormones, things like estrogen, go wild and go really high before they peter out. So yeah, one of the biggest things is addressing symptoms and just supporting our body in general while we're going through it. I joke with women, we're not going to go around it. We can't avoid it. We got to go through it. So let's just help you feel better going through it. And so symptom management is one of the biggest things. Again, I'll take a comprehensive approach. We'll talk about, what factors are really affecting them. So is it sleep disruption? Is it they're feeling really anxious? If they're feeling really depressed, they're having hot flashes or night sweats. And so using that, we can know sort of, okay, it's the anovulation that's really getting you. It's the high estrogens. And so we can best support them. The tools I use, it totally depends on what factors are going on. But there's some certain things like, we talked about detoxification of toxins, but even detoxification of like our estrogen metabolites can be an important one. So is our liver functioning appropriately? Again, are we constipated? Are we pooping well? We have a good amount of fiber to get those estrogen metabolites out. Looking at gut testing can be helpful there to see if there's anything impeding estrogen metabolite elimination. We can use supplements like DIM and, all these different like sulforaphane and things like that. We can also eat broccoli and broccoli sprouts and change our diet and use that in a way that can be really supportive. If there are things in our gut microbiome that are getting in the way, things like calcium D-glucarate can be helpful there. Just to kind of focus on that piece of it. There are different herbs that we'll use sometimes, like Vitex, for example, or chasteberry, that can be really helpful during this time to create some hormone balance. Well, again, we're not going to eliminate the whole, cause for the imbalance. This can buy women some time in a sense with their perimenopause and help restore some balance, at least for some time. Can help with higher prolactin as well, if that's a factor.
Yeah. Again, very personalized, right, to each woman's situation.
And I know you do manage bioidentical hormone replacement therapy, right, Dr. Naylor? So how do you determine if a patient's a good candidate for that?
Yeah. So we typically don't start there. if we can help it. So if it looks like there's some ability for us to support their own hormone production and balance and elimination and all that, then we'll do that. If it's beyond that, or if their symptoms are just too troublesome, or we've tried other things, they're not, it's not working so well, that's usually when we'll use them. And sometimes we'll use them in fertility as well, like progesterone supplementation or something like that. In this time, in perimenopause, usually we'll start with things like progesterone, try to create some balance, especially since it is a high estrogen concern most of the time. Just getting in some cyclical progesterone during the luteal phase can be helpful. Or if they're not ovulating regularly anymore, sometimes using that to create a cycle still is usually my entry point. I definitely use them as well in menopausal, postmenopausal women. And again, when it gets to a point where their symptoms are too much, we can't create balance any other way, then that's when they're a really helpful tool.
Any contraindications or risks in history that you're looking at for those?
Yeah. So of course, estrogen sensitive cancers would be a big red flag. Family history of breast cancer, personal history of breast cancer. Usually we're treading very lightly in those situations. The way that I see them, if we're using bioidentical hormones in a very safe, monitored way, meaning we start low, we go slow, we're really making sure that their levels are in a physiologic range, they're not getting too high, then I feel really comfortable with them in a lot of different situations. But again, if it's a very clear, cancer concern, then we're either avoiding them or treading very lightly in those situations.
Right. And treading very lightly, does that include vaginal estrogen for you?
Yeah, I do use vaginal estrogen for my patients as well. Again, depending on their concerns, especially if it's like vaginal dryness, pain with intercourse, then that can be a great tool. Of course, there is some systemic absorption even through that route. So it has to be considered as well. But yeah,
right. It's risk versus benefit.
Mm-hmm.
Yeah. And that's why we're having these conversations. It's so important that people understand that if they have that informed consent and you document that, that's important.
Mm-hmm.
Get that really solid history. So,
yeah.
Okay, that's helpful. And you mentioned on starting with the natural therapies first. What do you think about maca for male and female patients?
Yeah, I love maca as well. The adaptogens in general are great tools because it isn't necessarily forcing your body to do something. Sometimes I joke, like, we're trying to outsmart our body. Our body is very smart and is doing things that are mysterious to us. We don't fully understand everything. So that's where, again, just supplementing with some of these hormones sometimes isn't appropriate. Maca, ashwagandha is another adaptogen that's very popular nowadays. It can just be really nice in supporting your body and being able to do its thing and be optimized. Yeah.
Cool. Yeah. Okay, so now we're going back to fertility. I know we were just talking about menopause, but I want to talk about some of your offerings. You have a foundational fertility program. Can you tell us what that's all about?
Yeah. So basically, I found that working with couples on fertility, there's still, even though we're spending so much time talking about their history, going through their labs, there still wasn't as much time to really go into the education of, knowing when they're ovulating, knowing the best foods to choose for fertility and all of that. So I created this online course. I also wanted to make it approachable for people who couldn't necessarily work with me or another functional medicine doctor to be able to get a well-rounded, educational resource to optimize their fertility. And so basically it's based on a functional medicine approach to fertility and put into a context where people can be able to see kind of what are their own personal factors, identify that in themselves, and really know some actual steps that they can take to optimize their fertility.
Beautiful.
I love that. Yeah. I'm going to ask a personal question since I've got you here.
Mm-hmm.
I'm curious with women as we age. Like I've noticed an elevated mood swings, and it's interesting because when I think back, like there really was not. I wouldn't say I had quote unquote the PMS symptoms that you normally hear about. Is that normal as you age to start to see that sort of shift? I would imagine, but
yeah, it's common. Yeah. And I avoid using the word normal because we can get kind of caught in normal. Like things can be very common and not necessarily normal. Like you don't have to be having mood swings. You don't have to be having hot flashes in like these different phases. But absolutely, it's a very common, change that can happen even, in our 30s and things like that, as we start to have these effects of aging. And by aging, I mean, just the regular wear and tear and exposure to life that can have an impact. And start to have, elevated mood swings. It can be a very early sign of perimenopause as well. Before cycle even starts to change, sometimes women will experience that. They're like, I'm just really moody. I'm just having worse PMS. And then their cycle later starts to show the effects.
My
So
poor
the answer is
family.
yes.
I'm not even sure what answer I was looking for there, but I just assumed it was somewhat common.
Yeah. Well, I'm sure a lot of women can relate to that because, again, it's very common for a lot of us. Especially, I mean, stress is such a big factor there too. And it's easier said than done with addressing that. We can't just get rid of our kids. We wouldn't want to, but, being able to maintain that resilience can be a big factor with that too.
And every cycle is different too. I really, changes through the life cycle or not, every month I feel is different based on stress levels, diet, movement, all those things, right? So that's really important to remember too. All right. So I think we're coming to the end, Dr. Naylor, but before we wrap it up, do you have any favorite functional medicine women's health training courses? Do you have one or any books or resources that you want to pass on to the listeners?
Yeah, that's a great question. So I can't speak personally to it, but I know Aviva Ram, I love all of her stuff. And she actually has a women's functional medicine course that I think is, open right now. So if she wants to give me money for, no, I'm just kidding. Just plugging her just because I know that she has, she's a wonderful resource. Her blog and everything like that is awesome. And all of her books. I love Laura Brydon as well. And her book, Period Repair Manual.
Me too.
It's a great entry point. I feel like it's so well worded that anyone can understand it, practitioner or not. So that's a really great starting point as well. And then of course, IFM, their hormone module, it's at least a really good entry point. And their educators there, I think, are fabulous. So those are some great starting points to get into.
Yeah, I agree.
Repeat that first one, Dr. Naylor. I missed the first one.
Aviva Ram.
She
has a women's functional medicine course that's on.
Yeah, super prolific. Great recommendations there. Dr. Laura Brydon in particular, she's a naturopathic doctor like myself, and just her wealth of experience, because sometimes the research isn't quite caught up to what we're seeing in clinical practice. And I think that she's got a lot of pearls in that regard. Or there is a little bit of research, right? But there's just not enough to really say one way or another, but her blog's also fantastic. So I can echo that.
I agree. And that's where I've always struggled with, like, we can read ourselves, we can look at textbooks, but then really knowing the experience and, like, it's an art. So learning a little bit of someone else's art can be really helpful as a provider to know, start to develop our own protocols and all of that.
So well said. What about managing bioidentical hormone replacement therapy? Any training? I know a lot of practitioners are trying to get into it, but they want to do it safely, of course. So any tips there?
Yeah, that's a great question. I honestly, I don't think I've done anything in particular outside of IFM's training. I felt like that was actually really supportive. And I must have been done more since then, but I haven't done like a specific training in it, but I just read a lot on it. And I try to go into research where I can as well. And so I think that's where I've kind of developed my own protocol and training. I think coming from my standpoint of conventional medicine too, I maybe felt more comfortable too, because I had the conventional training and then I did the functional training on top of it.
Kind of depends on background where you're starting.
Yeah.
All right. Well, we're going to wrap it up there. But before we let you go, Dr. Naylor, we want to thank you so much for being here. We talked about building resiliency in our crazy, toxic world, particularly as women who are stressed out. And we talked about fertility and peri and postmenopausal management and so many important topics here. I'd love to have you back. And it's such a huge topic of conversation. And I'd love to learn about you more a little bit on a personal level. So before we say goodbye, do you mind answering a couple non-clinical in nature rapid fire questions for us?
Yeah, I'd be happy to.
Awesome. Okay. So mine is first, what movie could you watch over and over again?
Oh, that's a tough one. I don't watch many movies lately outside of the kids' movies, to be honest.
Yeah, it could be a Disney movie.
Yeah, I know, right? My
My
son was just watching The Little Mermaid for the first time, and I love that. I hadn't seen it since I was a kid, but that one got me, like the original, the OG
good.
Little Mermaid. Yeah. Yeah, other than that, I'm a comedy person. So, any like rom-com, it's just easy. I'll take it. Yeah.
Nice.
Cool. Okay, next one. Who is your favorite female historic figure or icon and why? And it can also be a family figure too, if you want to go that way.
Another tough one. These are hard rapid fire questions.
Not so rapid, but that's good. More thoughtful.
Yeah, of course. I honestly have to say that I'm so inspired by the women in my own family. My grandma, Helen, my mom's mom, was so, and I didn't appreciate her in the time that I had her, which makes me appreciate her even more now. She passed away when I was 9 or so, I think. And she was really interested in American history and was always ready to talk to us about that. And I think she was just a really amazing wealth of knowledge. And I really appreciate her. Some of the wisdom that she carried that was very, more traditional wisdom that I don't think we appreciate as much nowadays. So, yeah.
I love that answer. All right, last one, and then we're going to let you off the hook. If you had your choice, what superhero would you be and why?
I'll go with Wonder Woman.
Oh, yeah.
She's just a powerhouse. Can't go wrong with that. Yeah.
Awesome.
Enough said.
Awesome. Well, thank you for being such a good sport, Dr. Naylor. I just appreciate your transparency and what you have to offer women. Let the listeners know where they can find you, whether it's on social, your website.
Yeah. Well, thanks for having me. It was such a pleasure chatting with you both. You can find me on drmirandanaylor.com, which is my website. So it's DrMirandaNaylor at .com. Did I say at Gmail? That's my website or my email. And my Instagram is Dr. Miranda Naylor. So is my Facebook. So is my TikTok. While it is not very impressive, not very good on TikTok. But it's the same on all of them. Dr. Miranda Naylor.
Makes it easy.
Yeah.
Awesome. Well, again, thank you. We look forward to hopefully having you back another time. And to all our listeners, thanks for tuning in and stay vibrant. Until next time. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.